Welcome to this Ascent software video. In this video, we will cover FVC testing and testing options. The objectives of this course are to understand how to perform FVC testing, the ATS and ERS spirometry standards, how to coach the patient through the test, and how to change the software settings. Before testing, snap the prevent flow sensor onto the umbilical clip. The honeycomb label on the umbilical clip must be on the same side as the honeycomb of the flow sensor. Next, connect a filter to the honeycomb side of the flow sensor. The filter itself can be used as the mouthpiece. If a patient cannot keep their lips tight around the filter, a rubber mouthpiece can be connected to the filter to help ensure a tight seal. After entering patient information and clicking on the Begin Testing button, the software automatically takes you to the FVC test screen. You will see that the FVC icon on the right is highlighted in green. To perform another test type, simply click on the appropriate icon. Before performing an effort, make sure the patient is comfortable and fully understands the procedure. Explain the maneuver in simple terms and demonstrate how to perform an effort. Ensure the back of the flow sensor is not obstructed. The quality control gauge, flow volume loop graph, and the volume time graph are all active and updating in real time during an effort. Have the patient attach nose clip and put their lips around the mouthpiece. To begin an effort, click on the Start button in the upper left corner or press the space bar. Breathe normally for 2 to 3 breaths. Then instruct the patient to inhale as deep as possible. Then immediately blow it out as hard and fast as possible. When the patient achieves a plateau or a maximum exhalation of 15 seconds, have the patient completely inhale as fast as possible. Once the patient has completed the maneuver, press the stop button or space bar to end the effort. Provide continuous feedback to the patient during the maneuver to ensure the best possible effort is achieved.
To perform the first effort, the patient will insert the flow sensor, attach nose clips, and breathe normally for 2 to 3 breaths. Inhale maximally and exhale as hard and as fast as possible. When the flow criteria met, the entire standards gauge will be green. The patient then will inhale as fast and as rapidly as possible.
An acceptable effort will have a satisfactory end of forced expiration that meets one of 3 criteria: an exhalation plateau, or the patient has achieved an exhalation time of 15 seconds, or the patient cannot expire long enough to achieve a plateau. The back extrapolated volume error should be less than 5% or 100 mL, whichever is greater. There should also be no cough in the first second of exhalation, no evidence of glottic closure, and no leaks or obstruction around the mouthpiece. The difference between the inspired vital capacity and the exhaled vital capacity must be less than 5% of the vital capacity, or less than 100 mL, whichever is greater. The goal of testing is to have 3 acceptable FVC and 3 acceptable FEV1 measurements. Repeat the FVC effort until the software displays a repeatability criteria met message. Repeatability for patients greater than 6 years old is when the 2 largest FVCs are within 150 mL and the 2 largest FEV1 are within 150 mL. Repeatability for patients 6 years old or younger is when the 2 largest FVCs are within 100 mL or 10%, whichever is greater, and the 2 largest FEV1 are within 100 mL or 10%, whichever is greater. Allow sufficient time between efforts for the patient to recover if testing is difficult for them. The ATS-ERS guidelines state that 8 maneuvers is generally a practical upper limit for most adults. All of the acceptability and repeatability criteria for spirometry can be found in the 2019 ATS and ERS spirometry update. Accessing this document is shown at the end of this video. After each effort, you can review the test screen to verify that the effort met the ATS guidelines for acceptability. If the ATS column has a green checkmark, this means the effort was acceptable. If the effort has a colored ball in this column, it means something did not meet the ATS acceptability guidelines. Hovering your mouse over each colored ball will display a message indicating what was wrong with that effort. The Ascent software automatically selects the FVC and FEV1 that were acceptable. Checked efforts will be used for the final report. If an effort was unacceptable, the software will not select those efforts. However, the operator can manually check or uncheck any effort, depending on the acceptability of that effort. The FVC and FEV1 can be selected independent of each other. The ATS grading column displays the grades for FVC and FEV1 at the bottom. The FVC and FEV1 are graded separately according to the ATS and ERS spirometry update. The green boxes around the FVC and FEV1 data indicates the 2 largest, acceptable and repeatable efforts. The data in the green best row is the data going to the final report. The software also allows you to choose the inspiratory and expiratory loops independent of each other. Sometimes the patient is unable to perform acceptable inspiratory and expiratory loops in the same effort. In this case, you can choose the graph to represent the patient's efforts on the final report. To redraw any effort, click on the data for that effort. All efforts are color-coded. The colored highlight to the left of each row indicates the color of the effort drawn in the graphs. Right-clicking on a graph and selecting Graph Properties allows you to select how to display each effort, such as Montage, which is side-by-side, or Overlay, which places efforts on top of each other. Several other graph properties are available as well. Sometimes subjects need a little additional help to achieve a good effort, especially pediatric patients. When that happens, Ascent software has a variety of incentive graphs to aid in getting the patient to meet the ATS and ERS acceptability criteria. Incentive graphs that are available include a balloon, a baby bird, a birthday cake, and a train. Access to any of the incentive graphs can be obtained while in the FVC test screen by pressing F5 on the keyboard. This will bring up the FVC settings screen. From the patient incentive type drop-down list, select which incentive you wish to use, then click the Save button. The incentive graph will appear after starting the next FVC effort. The incentive graph can be resized and placed anywhere on the screen to allow you to see what is most important to you during testing. If the patient achieves the % predicted target as displayed in the lower right corner, the incentive graph will display a message of congratulations. If the patient is unable to achieve the target, the incentive graph will display a message of encouragement in hopes the patient can do better next time. Unfortunately, after a few attempts, some patients may get discouraged if they cannot achieve the target goal. If this happens, you can change the target on the incentive graph to something that is more appropriate for the patient, so the patient is more encouraged to continue giving maximum efforts. If the next patient will not require an incentive graph, go back into F5 settings and select None for incentive type, and then Save. Clicking on the ATS scorecard icon in the upper right will display all of the completed efforts and their associated acceptability and repeatability scores. To change to post-bronchodilator testing, select Post from the stage drop-down list. All efforts, regardless of test type, will now be performed under the post-bronchodilator stage. Many variables will have a %P/C column next to it. This indicates that in the pre-bronchodilator stage, these values are % predicted. In all other stages, such as post-bronchodilator, these values correspond to % change and are compared to the pre-bronchodilator effort. Other available icons in the upper right include technician comments, manual entry for variables such as hemoglobin and blood gases, trend results if the patient has had more than one visit, entry of auxiliary data fields, entry of visit questions, and reviewing visit information. To perform another test type, such as SVC, select the appropriate icon in the test queue. From the Report drop-down list, select the report to view, print, or send to physician review for the interpreting physician to view while interpreting the final results. Once the report has been selected, you can click the preview icon to preview the report, or click the print icon to send the report to a printer. Other icons available in the bottom right corner include opening the visit summary data, the ability to mark the test as completed, entering a preliminary interpretation, which could be manually entered or computer-generated, and the posting of data to the hospital EMR system. When all testing is complete, click on the home icon in the upper right. The software will ask if you want to mark the test as completed. If all testing, manual entry, and comments have been completed, select the Mark Complete button. This will let the interpreting physician know that this test is now ready to be interpreted. If additional testing needs to be added that day, select the Don't Mark Complete button. This allows you to go back and add test efforts or additional information. Additional settings for test screens can be accessed by being in the desired test screen, then pressing F5 on the keyboard, or going to the main menu and selecting Settings. While in FVC, pressing F5 will take you to the FVC settings screen. It should be noted that all of the F5 settings are user-specific. This means that one user can have personalized settings that are different from another user. If the settings page is locked, as indicated by the lock in the upper right, this means any changes made and saved will be for the current patient only. Upon entering a new patient, the settings will revert back to the original entries. If the settings page is unlocked, any changes made and saved will be used for future patient testing. You can unlock the settings by clicking on the lock icon, then make changes to the entries. Be sure to click the Save icon to save any changes you may have made. While in the F5 settings screen, clicking on the PF Test Tabular Data tab will display options for variables in the testing screens. In the Grid Variable Orientation drop-down menu, you have two choices, vertical and horizontal. Vertical is the software default and displays the data table in the test screen with the efforts going vertically down the screen. The horizontal option displays the efforts going across the top of the data table. This option is similar to the software that is used by some competitors of MGC Diagnostics, and may be more familiar if you have converted from another vendor to MGC. You can also select which predicted effort types to show in the data grid by placing a check mark in the appropriate option. The variables displayed in each test screen can be customized. The column on the right-hand side shows which test variables have been selected and the order of each variable. By highlighting a particular variable, you can use the up and down arrows to reorder the variables in the data table. To remove a variable completely from the data table, highlight the variable and click on the left-facing arrow. To add a variable to the test screen, highlight the variable in the Available Test Variables column. Then click on the right-facing arrow to move the variable to the selected Test Variables column. When all changes are made, click the Save button to save the changes. While in the test screen, additional options are available. By right-clicking your mouse over the data table, a menu will be displayed. The first option is to delete all unselected efforts. By choosing this option, the software will delete any effort that does not have either the FVC or FEV1 selected. This option is helpful if your subject has multiple efforts that are not acceptable and taking room in the data table. However, since there is no practical limitation to the data table, deleting efforts is not usually needed. A word of caution: once an effort is deleted, there is no way to recover that effort and it is permanently deleted from the database. Clear All Graph Efforts erases any efforts from the three graphs at the bottom of the test screen. These efforts can be redrawn by clicking on the effort in the data table. Collapse All Stages will hide all efforts for each stage except the best effort. This is useful when performing bronchial challenge testing, where multiple stages are used for testing. Copy Data to Clipboard will allow you to copy test data so that it can be imported into an Excel spreadsheet. Highlight the data you wish to copy, then select Copy Data to Clipboard. The test screen allows you to adjust the size of each graph. There is a splitter bar between each graph. When placing your cursor over the splitter bar, you can use your mouse and grab the splitter bar and resize the graph. There is also a splitter bar at the top of the graphs that changes the size of all three graphs simultaneously. By using the arrow at the bottom of the data table or the arrow at the top of the graphs, you can make either full screen and hide the other. As an example, during testing, you can make the graphs full screen. This may give you a better graphical image for determining the effort from the patient. If you want to again see the data table, click on the arrow to return to the default screen. A full description of each FVC setting can be found in the Ascent Operator's Manual. From the home screen, click on the About Help icon. Then click on the Help button. This will provide a list of all documents related to the Ascent software, as well as the latest ATS and ERS guidelines. Double-clicking on any PDF document will open that file. Thank you for watching this video. For more information on Ascent software, or if you have questions, please contact our technical support department at 1-800-333-4137 or email MGC Diagnostics at support@mgcdiagnostics.com.